So in terms of pregnancy, yes, Esther was right with respect to the hydrostatic pressure. It allows the fluid to flow more. I think that's how you... Okay, so what hydrostatic pressure does, if you remember, I think I mentioned it at the beginning of the course, hydrostatic pressure is exerted on your body and actually pushes your fluid into what we call your central circulatory system. Okay, so it increases everything sort of centrally, and so this is really good. You're right, that means that you have better venous return, so better blood flow back to the heart so that your heart can pump a little bit more efficiently. But what this is really good for in terms of pregnancy is decreasing edema. Now remember, edema is when if you take two fingers and you've got like a swollen bit and you put your fingers on the swollen bit. For pregnant women, it's going to be wrists, fingers, ankles, feet. You put two fingers on the swollen bit and you take them away, and if the imprint is still there, that's called edema. It's swelling where things aren't flowing. Okay, it's not positive swelling. But what will happen in the water is that this edema that is so uncomfortable actually goes away. Not completely, but it does a bit. There is some relief from it because the fluid is pushed centrally. So that's a huge bonus. The water is a lot more supportive. In terms of thermoregulation, one of the concerns about exercising in pregnancy is temperature control. In the water, unless you're, there is a concern if you're exercising in a 30-degree pool at high intensities, perhaps you're not going to be able to get rid of your heat effectively. But if you're in a cooler pool and you're not exercising intensely but exercising at a moderate level, you should be fine in terms of dissipating heat. And a lot of the concerns about increased heat actually came from studies that were done with sheep. It's kind of strange. All of the adaptations that occur in the human in terms of increased blood flow to the skin and stuff, they all work to actually decrease maternal core temperature during exercise, whereas sheep don't have all of those mechanisms. And so there was a lot of research done in the early 70s, late 60s, and it was done on sheep. And so they're freaking out about this. But I mean, we would have to be exercising at a really, really high intensity in order to get to the point of the core temperature that would be really dangerous for the fetus. But the water is fantastic for that, because the water is going to have a cooling effect, unless of course you're exercising at 30 degrees or higher, in which case you do want to keep it at a low to moderate intensity. So going through the different stages of pregnancy, some of the concerns in the first trimester, not so much body temperature. You don't get really hot in the first trimester, but fatigue and nausea. If a woman's going to get morning sickness, it's going to be in the first trimester. Sometimes it carries on beyond that, but usually around 13 weeks it's resolved itself, so it's not an issue. Those people probably aren't going to be coming to your Aquafit class, so don't worry about it. If they do come, then what are you going to say to them? Sorry?
Come in the evening.
How are you?
No, but they expect that they're getting the nausea and travel around it.
Okay.
Prepare for it.
Okay, because it's not a continuous nausea for some people. So get them to take notice of when they do feel nauseous or tired, and then work around that. There are lots of Aquafit classes on during the day. They can work around that. What else? What would we tell a regular client or a regular participant?
If they don't feel good, let me know, and like get a guard to watch them if they go to the change room and don't come back for a while.
Good point. Exactly. So, get them to monitor themselves, only exercise to what they can tolerate. If they don't feel well, get them to tell you, like encourage them, openness. You want them to let you know when they're not feeling well, and you'll just get somebody to go check on them or go with them.
Will a lot of them tell you, or will they try to hide it?
For me, in my classes, they're registered programs, so they're we're pretty open about that. Pretty open about a lot of things. But yeah, no, I have had a couple of people just get up and leave the class after they've told me, you know, that they haven't really been feeling that great that day. Now that they've, you know, not that they're going to explode or anything or deliver, but just, you know, maybe they felt sick or something with a cold. And if they get up and leave, I will ask a guard to go check on them. Yeah, it's really important. This is safety. It's not just safety for them, it's safety for their baby. Okay. Relaxed joints, we're not going to be too concerned about that in the first trimester. I mean, progesterone is going to play a part, but it's not a really big thing. That comes more into the later part of the second second trimester. How can you tell I teach at SFU too? Into the second trimester. And that's when you're going to, well, they're going to notice maybe a little bit more back pain into the bum and stuff, loose SI joint, maybe some clicking in their joints, just a little bit looser. This is a time when they're at increased risk for injury. Okay, so any super fast movement changes. I mean, granted, we're in the water. The water's right here. We're in the water, so you know it's not going to be like you're trying to get them to work on the BOSU and it's a huge risk of injury, but there is still a risk of injury there. Okay, so slow down some of your movements. Work on stabilizing the joints instead of trying to move super fast through the joints. Okay, low back discomfort. When they get into second trimester, more the later half of the second trimester and into the third trimester, what happens? So tell me what happens physically. Well, you don't have to tell me all the intimate details because you're not going to know them. But tell me, when you look at a pregnant woman, try and put me in that posture.
Stomach way.
Okay.
Kind of move the back forward.
Okay, so what kind of pelvic tilt was that? If I have a bucket of water in my pelvis, the water's going to go out the anterior pelvic tilt. Right, the water's going to go out the front. Okay, because you've got this big, right, so there's also weight there. Okay, so you've got an anterior pelvic tilt, much like you would see some portly gentlemen, shall we say. Okay, so you're going to have a belly that's going to cause that lower back, so that anterior pelvic tilt. So there's going to be back pain there. Relaxin is also present, so you're going to end up, they're going to possibly have hip pain into the rear, so more where the SI joint is. What, is this the only place where there's, okay, the breasts are going to get bigger, but that in combination with the fact that this is actually not very ergonomically correct for the spine, in order to combat the fact that this just went back, this has to go forward. So you're going to be slightly forward. Look what had just happened to my head. Okay, so it came forward as well. Okay, so it came forward as well. And one thing that you can't see where you are, but I'll hop up on the chair so you can see. I know. Okay, hopping up on the chair so you can see. If I've got an anterior pelvic tilt, so all I'm doing, just look from here down. What happens at my knees when I have an anterior pelvic tilt? What's that called? My knees are hyperextended. So this baby is not just here. This baby is throughout their whole body. And so posture becomes a really big thing. Trying to correct that posture, or at least combat the postural changes so that they don't have as much pain as they could possibly have. Another thing that could happen, pain in the middle of the pubic bone. Remember, the pubis actually comes together and there's some cartilage there. That's the pubic symphysis. The relaxin that's released works all over the body. It doesn't say, oh, yeah, here and not here. It works all over the body. So that cartilage and the ligaments around that area are going to stretch, not necessarily stretch, but loosen. And so it allows for more movement. And when there's more movement, that increases the risk of injury, right? Because it's not as stable. So that's something else you have to take into consideration. Abdominal muscle separation. In Aquafit, it's not going to be as big of a deal. As long as you don't do abdominal exercises on the back, it's not going to be as big of a deal because you're standing up. But what can happen, it's called diastasis recti, and it actually, remember the linea alba? Okay, and this is where the abdominal muscles pull away from the linea alba. And it happens usually a couple centimeters above or below, sometimes both, the belly button. And it's kind of freaky because if somebody's doing curl-ups, you're not supposed to do stuff on your back after the 4th month, but if someone's doing curl-ups, I've seen some people talk about how they'd come up or even get up out of bed and this little like boom would poke out from between their separation. Yeah, it's kind of funny. So then I say, so don't do that.
Some people freak out because of it?
They do, yeah, because they don't know. Nobody tells them these things.
It's like part right here pops out?
Not up here, no, just down here. Yeah, so it's just little pieces of baby.
The baby will stick like his hand out or something.
Yeah.
Because of the
Well, the uterus is there.
Oh, not like
And the skin is there. It's just like alien, yes. Sigourney Weaver, absolutely.
It's actually no.
The belly button is where the umbilical cord is connected, and that's how the baby gets the nutrients.
Ryan needs a little bit of
Because of this. SFU is not saying this.
You can have one of mine.
No, not SFU.
You're good.
Why, is that where you applied? In terms of, okay, so we talked about increasing heart rate and stuff, increased blood flow. Blood flow actually, or blood volume can increase up to 50%. It's amazing. And so that is going to change how you would monitor intensity. So if you're not going to be taking heart rates, I mean, you could still take heart rates, but good. Talk test and perceived exertion. Excellent. And then the 3rd trimester, it's a good idea for them to bring a snack with them, preferably high carbohydrates, and it's going to give them a little bit of energy. Fruit is an excellent option. Really good idea. Or one of them.
It's not going to go hungry.
Power of suggestion. And then pelvic floor muscles, another issue that you should be concerned about. Don't worry about it. If you take the pre and postnatal fitness module through CanFit Pro, you will get all of that information. These are just some things in case you have a pregnant woman who actually comes to your class. Okay? But this information does not, the stuff that I'm giving you now does not certify you to go out and lead a prenatal Aquafit class or a postpartum Aquafit class. Okay, this is good to know if you have people coming to your class. By the way, if you had somebody come to your class and she says, okay, I'm pregnant, or like it was obvious she was pregnant, tiny everywhere and then this big belly, what are you going to get from them? ParmedX for pregnancy. That, or there are some doctors who won't give those out, or who won't fill them out, because they're like, what is a fitness instructor? You need all this information. Okay. At the very least, you need a doctor's note. Yeah?
So if they come to your class and they don't have it filled out, do you have to tell them that they can't do it, or what do you say to them?
What you can do is say that they can participate at a walking pace. So they can't work any harder than a walk. And if they start to get upset, to say this is not just for your protection, it's for the protection of your baby.
What was the name of the form?
The ParmedX for pregnancy. If you go on cset.ca, it's there.
Doctors can get them too.
Midwives can.
Oh, can they?
Yeah, midwives and doctors.
What are midwives?
A midwife is somebody who is it's a paramedical, so it's somebody who's trained. She's taken all of. Usually, it's a she. It's somebody who's taken all of their courses and everything to enable them to deliver in uncomplicated pregnancies.
Oh.
They can't perform C-sections, but they can perform. They can deliver babies in a natural way.